but many of us already know. Central Texas is still tops in the state for having a good standard of living, especially when it comes to health. Williamson and Travis counties are taking the new rankings not as compliments, but as ways to improve on what's working. Rhonda Lee has more all new at 6.
Overall, Williamson and Travis counties are in great shape, ranking 1st and 6th in the state respectively. Both counties' health departments say despite the great rankings, they won't rest on their laurels.
These numbers are absolutely something to celebrate, but keep in mind that the county health rankings are not a tool, a race to the top. It's a tool for improvement.
Standard of living studies have been done for a long time, but this is the first time that so many factors were used in just about every county in all 50 states. Factors include everything from mammograms to recreational facilities and their access to all of it.
It's not to be used as a comparison amongst counties across state lines, but it does at a statewide level help policymakers and health departments and others look at what do you look like compared to your other counties and what kinds of investment and things you should be doing to maybe improve in those areas that you're not.
Excessive drinking, which measures extreme consumption and binge drinking. Our county measured 17% against a statewide average of 16%, but the national benchmark is 8%. We'd rather be there.
One common link that both counties point to for their success is the access to a good education.
Some of our other areas we talked about in terms of high school graduation, and some of those things are areas we need to talk about. How do we invest more in those areas?
We have good schools in our communities, and I think a well-educated populace is really the core to having a healthy population.
The numbers aren't just for the city's edification. They're also for a long-term administrative accreditation goal for both counties.
The National Public Health Accreditation Board, which is an accreditation board responsible for overseeing public health agencies, will be doing accrediting next year for the first time. And so this helps in terms of identifying health assessment efforts that we need to undertake
to make Central Texas the very picture of health. In Austin,